Good day, everyone, and welcome to our discussion about language delay. I am Abigail L. Ramirez, and I will be your today's discussant. In this video report, we will learn more about the causes and symptoms of language delay in children, as well as some tips for encouraging their language development and a case study on the subject. Any parent wishes for their child's development to be proper. One of the main worries of the parents is that they are concerned about their child's speech or language development. They are concerned if their children are late in speaking, right? I myself is a mother, and this language development is one also of my concerns when it comes to my child's language development. And I need to be mindful in that aspect because I know it can have a detrimental effect when my child starts schooling. But how can we know if our child is experiencing language development delay? In this video, we will be exploring on that matter. A language delay is a type of communication disorder. Language delays involves delays in speech or language development. It happens when children don't meet the language developmental milestone for their age. Say for example, if your child reached the age of 4 and still can't able to produce words clearly, then as a parent, you need to be alarmed in that because maybe your child is experiencing what we called language delay. It occurs when a child learns linguistic abilities in the expected order but at a slower rate than expected. Children with language delays may have a harder time understanding words or phrases, saying their first words, learning new words, or combining words to form sentences. In society, it is common to find various language developments in different children. There are several children in the age of 2 years who have been able to mention words clearly. Even there are also children in the age of 3 years who have been able to speak clearly, sing a song, and even memorize fluently. Yet, there were also children who reached the age of 4 years but are still difficult to mention words or phrases. Children who have language delay may have trouble expressing themselves or understanding others. Their delay may involve a combination of hearing, speech, and cognitive impairments. So as a parent or parents-to-be, you need to be careful on that matter. Language delays are quite common among children. According to the University of Michigan Health System, delayed speech or language development affects 5 to 10% of preschool-aged children. They are sometimes temporary and may resolve on their own with little specialist intervention. However, some language delays may be indicative of a more serious disability or developmental disorders. Language delays may also cause behavioral problems in children who become frustrated by their inabilities to express their needs and wishes. Some recent research indicates that children who experience language delay may develop long-term emotional challenges, showing from their early difficulties with communication. There are two types of language delay. The first one is what we called the receptive language. A receptive language deficit happens when your child has difficulty understanding a language. A child may experience difficulties in understanding a language, like for example, at 12 months, child does not even recognize their name, or at 15 months, he or she does not point or look at object when you name the object, or even at 30 months, the child does not respond by nodding or doesn't respond when asked a simple question. So parents, you should be mindful on that matter. The second type of a language delay is what we call expressive language. An expressive language disorder happens when your child has difficulty communicating verbally. In expressive language delay, a child may have communication difficulties. Communicating with others may be harder to children with language delay. Like for example, at 18 months, the child is not saying mama, dada, or other names. Or at 24 months, the child is not using at least 25 words, or even at 3 years old, the child is not asking for an object with a complete sentence most of the time. If the child has a language delay, they won't reach language milestones at their typical age. Their specific symptoms and missed milestones depend on their age and the nature of their language delay. There are different symptoms of a language delay according to Healthline website. Here are the following symptoms of a language delay. Not babbling by the age of 15 months. Babbling is a stepping stone towards talking. When babies or toddlers babble, they are actively learning how to coordinate and move their mouth for talking. Generally, the diagnosis of a late talker is reserved for children between 18 and 30 months of age. This partly is because of the large variation between children in the early years. However, if a 15-month-old is not talking at all, this would be considered a developmental delay. The second symptom is not talking by the age of 2 years. While it's expected for 2 years old to continue babbling, we also want to see that they begin to use more words and less babbling. A child or a baby who doesn't respond to sound or vocalize should be checked by a doctor right away. Another symptom is that a child may have an inability to speak in short sentences by the age of 3 years. A child who can't say a few words and can't put them into understandable phrases may have a language delay. If your child is 2 years old and they haven't started talking, they may need a little extra help learning to talk. Another symptom is that a child may have difficulty following directions. Poor working memory, poor auditory process, and a hearing deficit may cause children not to follow directions. Another symptom of a language delay is that the child may have a poor pronunciation or articulation. By 2 years old, most toddlers will say 50 words or more, or even they can use phrases. However, children might have a language delay if they sound immature and don't even pronounce words. Another symptom is that they have difficulty putting words together in a sentence. By 2 years old, they can only imitate speech or actions and doesn't produce words or phrases clearly. Or they can't even use oral language to communicate more than their immediate needs. Language delays in children may have possible causes. In some instances, more than one factor contributes to a language delay. The first cause of a language delay is a hearing impairment. It's common for children who have a hearing impairment to have a language impairment as well. If they can't hear language, learning to communicate can be very difficult for them. Hearing loss can affect a child's development of speech and language skills. When a child has a difficulty hearing, the areas of the brain used for communication may not develop appropriately. This makes understanding and talking very difficult for them. Another cause of a language delay is autism. While not all children with autism have a language delay, autism frequently affects communication. Autistic children can find it hard to relate to and communicate with other people. They might be slower to develop language, have no language at all, or have significant problems with understanding or even using spoken language. And even they might not use gestures to make up for the problems they have with words. Another causes of a language delay is their intellectual disability. A variety of intellectual disabilities can cause language delays. For instance, dyslexia and other learning disabilities lead to language delays in some cases. Let us have this one case study about speech delay and its affecting factors. This is a case study in a child with initial AQ. It's according to Syuam Swardi, Faculty of Education, State University of Makassar, South Sulawesi, Indonesia. The subject of the study was one child with initial AQ. According to this study, the measure of child's capability development can be conducted by observing the child's abilities when speaking and responding to some of the responses related to the use of communication in the environment around the child. BT in 2013 measured the child's speech by looking at the response in the form of listening but not talking, giving one-word answers, giving responses in short phrases, doing the chanting, participating in the conversation, speaking in long sentences, and asking and telling a story. Based on the preliminary observation conducted, it is found that the speech development of a child with initial AQ, which is 6 years old, is very low. This child is actually in the period where he already has sufficient vocabularies, the ability of mentioning words correctly, the ability of understanding the language, and the ability of producing long sentences, but still not achieved. So in the research findings, there are two factors affecting the speech delay of EQ. The first factor is we have the physical factor, and the second one is the environmental factor. In the study, basically, the physical condition of EQ does not show any abnormalities or disorder in both the hearing and the structure of the mouth and the tongue. It is based on the observations made to know EQ's ability to listen when called upon by using a small sound frequency. In addition, the structure of EQ's mouth, the tongue, and the feet do not have problems to support his speaking ability. One of the reasons of affecting speech delay with the child EQ is the family environment. This is caused by lack of understanding or nurturing a child. In the study, it is found out that the first 2 years of nurture of EQ was just entrusted to a babysitter with lack of understanding, without education or enough training on how to take good care of the child. It is also found out that the caregiver admitted that she did not pay attention to the child's speech development. The second reason is that the parent's speaking style following the child's speech style. As what EQ's parents did in their communication with children, the parents did not act as a good speaker to be imitated by their child. They just imitate their child's speech or the common way of we have as baby talk. This of course will encourage children to produce words in inappropriate way. Another reason under environmental factor that affects EQ's speech delay is the school environment. Based on the interviews, EQ's speech was still considered to be very poor because he only used more sign languages and could say only one word. EQ then was regarded as one of the children who liked to disturb his friends at the time of learning. However, no treatment or intervention was made by the school to address EQ's problem. Another reason is the community environment. The communities where EQ lives could not support his interactions with others, especially with his peers due to lack of interaction. EQ lose opportunity to play with his peers at the age of 4 to 5 years old. Also, EQ could not interact with people around his house. Language development is an important factor in the interaction with the society so that the problems experienced by children, particularly in their speech ability, will affect the other developmental aspects. EQ's inability to speak well was caused by the environmental factors that did not provide the opportunity for EQ to explore his speech toward the environment in his first year. The role of parents in teaching children to communicate was hindered by the lack of time by parents and also children spent together. In addition, lack of support from the community at schools that do not provide early treatment efforts can also be the case factor. If your child is diagnosed with a language delay, it is important to start treatment quickly. Early treatment can help prevent other problems from developing, such as social, learning, and emotional problems. Let us have these tips for encouraging language development according to the Helpline website. First tip is that talk to your child when the time they are born. It is important to parents to focus on communication even if their babies are still newborns. Talk with your baby, sing, and encourage imitation of sounds and gestures. Second tip is that you need to respond to your child's babbling when they are a baby. When babies or toddlers babble, they are actively learning how to coordinate and move their mouth for talking. When your child is babbling, you as a parent need also to respond so that they can feel your attention is on them. Another tip is that you need to sing to your child even when they are a baby. Singing can enhance language development, and even if they are still a baby, sing with them to encourage movements of their lips and gestures. Another is that you need to read aloud to your child. Start reading when your child is a baby. As a parent, you need to look for age-appropriate reading level materials, either soft or board books or picture books that encourage kids to look while you name the pictures. The last tip we have, answer your child's questions. As a parent, you need to use everyday situations to your child. To build on your child's speech and language, talk to your way through the day and answer their questions, especially when they are curious about something. Explain to them what you are doing, example like when you are cooking, cleaning a room, and many more. So as a parent, you need to keep things simple and you need to avoid the baby talk. And for the last of this video report, let us have this activity wherein you are going to comment or give your observations about the language development of the child in the video that I am presenting to you. So I have this profile of the child. He is 2 years old and 4 months. His physical condition, he has no physical abnormalities. So you need to comment or say what you're going to say about the speech development of the child while he is conversing or talking to his daddy. Good luck!
Switch off. Switch. Okay. Okay. Switch off the remote. Switch off the aircon. Then press the button. Press the button. Can you? Please. Up. Shut up, Kier. Keep quiet. Tell to Kier to keep quiet. What are you doing? Let's talk. Don't just laugh at me. Huh? You talk to daddy. Remote. 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 Aircon. Sean.
Say it, nak. Say it, nak. You talk. So what? Aircon. Aircon, say it.
Aircon.
Aircon.
Huh? Aircon. 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 Flower. Yeah,
Flower.
Aircon.
Flower.
Can you, na,
Flower.
this one, Sean, this one, flower, flower.
Kami.
Hoy, flower.
Ganison. Gani.
Ikaw, Ker.
Lapis.
Flower.
Lapis.